Alright, so here's the UAC setup. Now obviously I don't have it going into the umbilical cord for the baby. I've just got some stuff set up. So you'll see over here there's a saline bag. So I believe that's a 500cc saline bag. It's hanging up. I've got this opened. This is open so that fluid will flow through. Now there's no pressure on this, all gravity fed, but nonetheless it should do enough what we need. So I've got in line a flush syringe. Here's going to be your waste port down here. Here is your sample port, and then this is obviously the blood from which the patient's the blood from the patient. So in order to access this, you'll need to take that three-way stopcock and turn it down. You'll want to leave for sampling purposes, you'll want to turn this stopcock down. You'll take a slip tip syringe, which I had, here they are. You've got two slip tip syringes right there. So you'll take the larger of the two slip tip syringes and you'll put it in here. You'll need to clean these ports with alcohol. Clean both those ports with alcohol. Insert your syringe, withdraw enough blood until you have until the line clears and you've got just frank blood in there. Typically about 3 cc's or so will be enough for that. And then you'll take and clamp that down. Then you'll take the smaller of the two slip tip syringes, place it in here, withdraw your sample, remove that, clean the port again, and now at this point you're ready to unclamp. You'll have your syringe still stuck in here, so you'll push your fluid back in and it'll go right back into the syringe. Then you can turn the stopcock back up to the off position, and then with your flush syringe that we have here, you can take that and flush the system through. Now I've got this particular item here sitting in the cup because you're going to see you'll need to utilize this to flush the system through and empty that out once you've got that cleared out. Depending upon how much is left in that large syringe, you can bypass this over here and just flush back up into the syringe. But right now we don't want to dilute everything and make it look more pink than what it already is. So now that I've gone through that, I'm going to go through right quickly and just do the hands-on component of the actual system. So we'll make sure that this is open. It is. I want to have these items turned so that I'm going to go ahead and be sampling, so I'm going to go ahead and turn that down. I'll have these positioned so that I can withdraw blood from them, and keep in mind I'm trying to hold a phone and do this all with one hand. So you'll take an alcohol prep or chlorhexidine swab and you'll clean both of those ports off. Take the larger of the two and make sure before you withdraw anything, so you don't pull any of the saline flush out, that you turn this stopcock off. And you're going to take a brand new syringe. This has been cleaned. Plug into your waste port and withdraw your waste. So once you've got 3 to 5 cc's back, take and clamp that. Your sample syringe. Go ahead and withdraw your sample. You've got your sample. Cap that, set it aside. Clean this port again. We'll unclamp. Unclamp, and now you're ready to push your push your waste back in. Typically always pull up on the plunger just a little bit to make sure there's no air bubble that's seated in there, and now you can push your waste back in. And typically you want to push the waste back in right until you get to the last little bit, and make sure you don't push the last little bit, make sure you don't push an air bubble through. So then you'll pull this out. That can, in the hospital, just be tossed in the trash can. Go ahead and clean that port, and now you're ready to flush the system. So you can leave it like this. You can leave it like this and utilize your flush syringe. Now you'll need to turn the flush syringe open to the line, the stopcock open to the line. That way you can flush everything, and you can flush it back into that syringe if you like. So you can see that the line cleared after I did that, and that saline flush went into there. Now if you happen to get to a situation where you need more saline flush, just turn the three-way stopcock off and then aspirate it from the bag that's hanging. And when you flush it, you want to flush just enough to clear the line back through the umbilical site, because you don't want to be giving the patient a fluid bolus when you do that. So now that that's off, this is done, and with no more than what you guys are going to be pulling out of it, I would say just flush back into the syringe as opposed to trying to dump it into the cup. I think that'll work a little bit better. But that's pretty much the setup. I know everything was one-handed. I'm going to leave everything here and ready to go for you guys. Go ahead and squirt the excess out into the sink, and that's a UAC draw with this particular setup.